So, hello everyone. My name is Crystal. I'm an OTA PTA student from Humber, and I am just going to go over some one enabling activity, and I'm going to make it purposeful. So, pretty much, it's going to be an activity that is not necessary. You're not necessarily doing the whole thing, but you're doing a part of it. And then after, I'm going to get you to actually complete the whole activity, if that makes any sense. Yeah. Okay. Perfect. So the area we're working on occupational performance. So more specifically, we're going to be working on meal prep. And the enabling activity that I chose for you guys to do today is assembling ingredients. Okay. So has anybody ever done ever built their own recipe?
Yeah, I have before.
Yeah.
It's pretty hard.
Yeah. Okay, so we're gonna actually do that activity. We're gonna build a recipe for a simple shrimp pasta. And then we're gonna make it purposeful by actually using that checklist or that ingredients list. It's actually making the pasta. Okay. So everyone's okay with that, right? Like I just want to get your good. Okay. So then let's do it. So I'm gonna pull up this little activity sheet. Can everyone see that? Oh, no, you guys can only see. Okay, 1 second. Here we go. All right, now can everyone see like my little activity sheet?
Yes.
Okay, perfect. So what ingredients do you guys think can go into a simple shrimp pasta? You're able to just throw ideas at me and I'll type it in.
Well, the pasta.
Okay.
Shrimp.
What type of sauce did you guys like?
Ooh. Let's go with a cream sauce. So cream.
Okay. I did
some
sorry guys. I'm probably gonna spell this so wrong. Sauce. I promise I'm just not there. Okay, cream sauce. What else? I did add more boxes than needed, but that's just in case.
Maybe garlic.
Garlic. Okay.
Herbs and spices.
Okay, so spices.
She knows her recipe.
Maybe some cheese.
Ooh, cheese.
Ooh, good one.
How could I forget about cheese?
Right?
I know.
Yeah. And anything else. It's okay if not.
I think that's it.
Sounds about right.
Okay, so
Garlic bread.
garlic
Ooh.
on the side. Okay, perfect. All right. So we have our pasta, our shrimp, our cream sauce, garlic, and herbs, cheese, and garlic bread for the side. And you can see that I placed some like a little bit of like a checkbox kind of pattern on the side. So that's something you can actually take in to meal prep and use as you're going along. Now, I know a lot of you guys might be asking why a checklist or what makes a checklist fitting for an activity for me, especially that we're dealing with cystic fibrosis. Now, with cystic fibrosis, it is common for patients to become breathless, right? So has any one of you guys experienced shortness of breath ever since your diagnosis? Yeah?
Yeah, I have.
Okay. So with this checklist, it actually helps with allowing you to gather the ingredients you need, right, before you actually go out there and do your meal prep. So instead of you running around the kitchen and trying to find all of the things that you need, you can go use your checklist, take your time, sort through what ingredients you actually need, bring them to one section of the kitchen you're going to be working at, and then work your way down from there. And you can use the check boxes as you get each ingredient. Now, I'm going to switch my screen back to the slides and show you guys other tools that you can use before actually, while doing meal prep. All right. Sorry. So, oops, I keep playing with the slides, but you guys can use the 4 Ps. Has anyone heard of the 4 Ps before?
Yep.
Yes. Okay. So of course, planning, pacing, prioritizing, and positioning. So when you guys are completing your purposeful activity, which of course is making the pasta and actually incorporating that checklist into meal prep, right? You guys can, well, the checklist of course helps you guys plan, right? Pacing, work at a slow pace that will actually decrease your levels of fatigue. You're going to prioritize what you need. So instead of you trying to make a 4-course meal, you can only do probably 2 things like we decided, right? Pasta and a garlic bread, right? You can also decide to make a big portion of pasta and put, I don't know how to really explain it, but you could put it into reusable containers and kind of set them out for the week. So you're not constantly wasting your energy trying to cook every single day. And positioning. When you're cooking, it's fine to take a seat because you don't want to use too much energy and overwork yourself. Okay? All right. So other tools that you can use is breathing techniques. My favorite is called the slip breathing. So I don't know if you guys want to try it with me, but all you have to do is smell the roses in for 2 seconds and blow out the candles. You're going to purse your lips for 4 seconds. Do you guys want to try it with me?
Sure.
Yeah. Okay, ready? So we're gonna smell the roses in for 2. Smell the roses. 1, 2. We're gonna blow out the candles for 4. Blow the candles. 1, 2, 3, 4. Awesome. How did that feel?
Great. Feels great.
Really good. Thanks.
Yeah, no worries. Is there any questions before we move on? No? Everyone's okay?
Questions?
Hey, did you guys find the activity useful? Yep, and you guys understand how you can take this checklist into actual meal prep and make it purposeful to you? Yes. Now you can use this checklist in a number of different ways. It doesn't only have to be for food and ingredients. It can also be for the tools that you need when you're cooking. So it can be for pots, knives, pans, different dishes that you might need. If you need a whisk, just to make sure that you're organized and prepared for meal prep. Okay. Okay, awesome. So I'm going to pass my OTA hat over to my next fellow OTA for them to explain psychological interventions.
Okay, so I'm going to be explaining psychological interventions. I'll just let you guys know who I am, and then I will go into like a little overview of what I'm going to teach you today. And then I have 2 activities for you guys. Stop me at any time if you have any questions, or if I'm talking too fast, because I am a rapid speaker. So if you miss something, by all means, let me know. My name is Emily. I'm an occupational physiotherapist assistant student at Humber College. I was sent by your OT to teach you guys some psychological interventions. So let's move on to the next slide. Okay, so what is psychological intervention? Psychological interventions are methods that focus on altering behavior, emotional state, or feelings. So positive psychological intervention focuses on boosting positive feelings or emotional state and promoting positive behavior. Psychological interventions for cystic fibrosis focus largely on adjustments to social and emotional well-being and one's ability to cope. So that's a big part of it, providing coping mechanisms. So you have good outlets to deal with stress and anxiety, adherence to treatment, and providing nutrition and dietary consumption. So making sure that you are getting the nutrients that you need, a proper diet to help with like a healthy lifestyle, and increasing feelings of happiness, well-being, and increased positive thoughts and emotions, because your body is linked to emotions. So anything that you feel is going to have a physiological response, right? So anxiety and depression are two of the most common psychiatric diagnoses in individuals with CF, and they occur at higher rates in people with CF than in the general population, which is understandable. I mean, you guys have been diagnosed with a condition that's kind of hard to control. Sometimes you don't understand the feelings that you have with the condition, and things are a little bit confusing, and it's totally understandable to feel the feelings that you're feeling now. However, depression seems to be the most detrimental. So moving on to the next slide. So I have some psychological interventions. There are tons. So if you see some here that maybe aren't your jam, by all means, talk to your OT, talk to your doctor, anybody in your health care team, and they can give you other ways, other psychological interventions. These here are just a few. So I'll go through a couple of them. So empathy interventions that focus on healthy social bonds and strengthening relationships. So it's good to have a good support system, especially with a condition like this. Having other outlets outside of these other interventions that I'm going to show you are great. Determine the things that you find most important and most meaningful to you, setting goals to help you find realistic goals and to find realistic solutions to those goals, and utilizing the most effective ways of completing those goals. So reflection and thoughts to make goals positive, right? So mindfulness, I actually have an activity for you guys later, so I'll go through it a little bit more, but it's bringing attention to the present. So intentional attention to the present moment, and positive affirmations. So positive affirmations, you guys probably seen it's all over like Instagram and stuff right now. It's affirming phrases that help you, that like can provide happiness that you feel like you've earned, right? So I forgive myself, I deserve to be happy, all those kind of things. So then we have some other psychological interventions. I have cognitive behavioral therapy there for you guys. It focuses on the problem and a solution. So concentration on the positive characteristics that the client exhibits. So there are other ones like music therapy, relaxation therapy, and like guided meditation, progressive muscle relaxation. So tensing is a natural physiological response to anxiety and depression and that kind of stuff. So going through each part of the body and relaxing, actively relaxing your muscles, it'll help to decrease anxiety, bring down respiratory rate, all that kind of fun stuff. And then breathing techniques. So diaphragmatic breathing, pursed lip breathing to help you bring down, I think when you start to feel anxious, you start to rapidly breathe. So it'll help you with that. So we'll go on to the next one. So here are some more psychological interventions. I have a gratitude sheet there for you guys. We will go through another gratitude activity in a moment, but I just want to show you that there are other options. So there's tons of worksheets that you guys can work through if you'd like to do them on your own. If you don't want to do things in a group, you can. There are group options as well, which is great with psychological interventions because there's so many different options. So again, if you see these ones here and they're totally not your jam, you can totally find another one that'll work for you. This one here on the side beside it is a psychotherapy worksheet. It's kind of hard to see on the slides and I apologize, but I just wanted to provide it there for you guys. It's a really good way. It's like a nice visual. So it's a what could happen on this sheet versus what will happen. So it'll, it's a nice visual to see where anxiety stems from. You can write down, it'll has little prompts there for you. Oh, sorry. Has little prompts there for you and it'll go through different parts of your anxiety. So I quite like these ones. They're really good, like nice visual tools. So I have a little activity for you guys. we're going to go through a gratitude activity. This is a really nice, like grounding activity. I have a dice here for you. On the next slide is a copy of the dice. If you like this activity, you can print this out and keep doing it. What I'm going to do is I'm going to roll the dice, and then one of you, it's like a prompt that's on it. So for example, what is something that made you laugh today? So then you can just tell me the answer to the prompt, okay? So each one of you just give me an answer as I roll the dice. Cool? Okay. So we got, the first one is, what's the best thing that's happened so far? What is the best thing that's happened today so far? Any of you want to answer?
I got to go for a walk.
Ooh, okay, love it. Okay, next one. We'll do one for each, and then I have another activity for you guys, so I don't want to take up too much of your time, but we'll go through it just one each, okay? What's the kindest thing someone has done for you recently? Anybody?
I guess like people checking out on you. I got a bit
Aw.
of my friends checking out on me from time to time. So that's
No, that's great. And then that's a really good example of a good support system, right? So that's great. And the last one. Okay, what made you laugh today?
My dog, he kind of just did something really funny today, so that made me laugh.
Okay, and then I'll do one for myself. What one to be happy? Do we have a different one? I just want to see if there's one that we haven't done yet. Who have you enjoyed being around? My family. They're always funny. They're always like super encouraging, so that's great. Okay, so that's the gratitude activity. Just like, you can do this in a group, you can do this by yourself. It's a really good way to like stop and pause and make a list of the things that you're grateful for. It's a really good grounding activity. Kind of brings you back to center. The other worksheets that I had provided for you earlier, those are, again, great visuals. You can collect them, you can keep them, and then you have these like really nice collection of things really nice things to say about yourself, really nice things to, really nice visuals to see where, like, how far you've come, right? So some benefits of psychological intervention. So just overall improve physical health. Like I said, emotions are connected to the body. So it'll decrease some of the physiological effects that anxiety, depression, stress, all that kind of stuff has on the body. So decreased insomnia and better quality of sleep overall. When you're not sleeping, you're not making the best decisions, you're tired, you're irritable, it affects your mood, it affects everything in your day-to-day. So benefits of psychological intervention: increased sleep, increased quality of life, decreased feeling of stress, anxiety, and depression, so those comorbidities, and improve self-esteem and emotional resilience, right? So I have one more activity for you guys, and I apologize, it's going to require you guys standing up just for a second. So we're going to follow this how to get grounded activity here. So what you're going to do, it's better usually if you are planting your feet on the ground. So you're just planting, I don't know if you can see my feet, but you're just planting them on the ground, just like normal. It's better in your feet. You get a better sensory response, but the floor is cold, so I totally don't blame you if you're wearing socks. So what we're going to do, I'm just going to explain it to you quickly, and then we can go on from there. So you're going to place both feet on the floor. You're going to stand up straight, and you're going to, you can do this sitting as well, and you can have the back of the chair supporting you. But this way this is like a really good position to breathe, right? So what you're going to do is you can put your hand on your chest, you can leave it at your side, you can hold onto the chair for support, whatever you'd like. I'm going to tell you guys now, if you're feeling lightheaded at any point, if you're feeling like you're going to faint at any point, or any other symptom, please sit down, please stop, okay? So keep your chair close. That way, if you do need to rest, we're not going to be doing anything extensive, but just in case. So we're going to breathe. So you're going to inhale slowly, and you're going to count to 3. So 1, 2, 3, and you're going to release through your mouth. So almost like pursed lip breathing. You're going to do this again. We're going to do this 3 times, okay? So now that we're calm and quiet, I just want you guys to notice 5 things that you see. Okay, so notice, take a look around the room, take an inventory, notice 5 things that you see so that you can understand. I will show you, or I will tell you 5 things. So right now I see my lamp, I see my pen on the desk, I see a cup on the table, I see scissors on the table, and I see my candle. So this is a great way to scan the room and ground you to see like your objects around the room. 4 things that you can hear. So I can hear the furnace going off. I can hear the laptop. I can hear some wind outside, and I can hear my dog sleeping. 3 things that you can feel. My sweater that's super soft to the touch. I have a lip gloss here that's a little goopy on the side. And then I have a candle with some hard wax, okay? And then 2 things that you can smell. I can smell the candle and I can smell my own perfume, okay? So it's a good way like, to go through each sense and to see, and to ground you through each sense, okay? So if you want, you guys can go through it, but I can let you guys go through it on your own because I don't want to take up too much of your time. But the resource is here for you so that you guys can do this again, okay? Okay. Thanks, guys. Thanks, guys, for participating.
That was very helpful. Thank you.
Does anybody have any questions for me? No, you're good. Okay, great. Thank you for coming to my session. I quite enjoyed having you guys here. I'm going to take off my OT hat now and pass along.
All right, so now we're doing adaptive equipment and then environmental adaptations. So again, my name is Chris Lee. I am an OTA PTA senior firm member, and I want to thank Emily for that wonderful presentation on the psychological part of this session. So before we get into it, what is the first thing you guys think of when you hear the words adaptive equipment or environmental adaptations?
Maybe like making like your environment a little bit easier to move around it.
Good. That's a good answer.
Making changes.
Good. Anybody else?
A personal appliance. Can you guys hear me?
Yes. It's very well. It's very good. So those are good answers. But before we jump into the specifics of adaptive equipment and environmental adaptations, we're just going to go take a look at the quick overview of cystic fibrosis. So we're going to go on to the next slide. So cystic fibrosis, it is a genetic disorder causing severe damage to the lungs, digestive system, and other organs, depending on the severity. And signs and symptoms include coughing, lung infections, wheezing, shortness of breath, as what Crystal mentioned earlier, as well as poor digestion, diarrhea, possible inflammation of the pancreas, infertility, and pneumonia. So that's a quick overview of cystic fibrosis. Now we're going to go on to the next slide, okay? So now the role of occupational therapy in this component is to increase the independence and develop skills in occupational performance, right? If a client has experiencing shortness of breath, then they might have difficulties performing or engaging in their activities of daily living, right? And they wouldn't have that satisfaction of being able to do something in their life. So for this component, I will provide information on adaptive equipment and environmental adaptations to improve quality of life for this population. And the main goal is to prevent overexertion and to perform activities in a safe and manageable way. So we're going to take a look at the assistive device onto the next slide, okay? So this is just a general idea of what assistive device is. So the purpose of assistive device is it helps the client to increase functional independence and accomplish tasks without overusing their body. So let's just get a second. So there's different types of assistive devices. There's the dressing stick, the sock aid, shower bench, long-handled sponge or loofah, depending on which one you prefer, commode, electrical appliances, and pill boxes. I'll only put pill box at the end because a lot of the people in this population require to take medication. So we're going to go into details onto the next slide. So more detailed, the dressing stick allows you allows the client to prevent any overbending, overreaching, or over twisting while dressing, right? Because on a regular day, let's say, or before the condition when we dress, we tend to overbend when we're trying to put our pants on, or when trying to reach, right? And depending on what we're trying to wear, or any twisting, trying to adjust your belt, stuff like that, the dressing stick allows you to put on your clothes without overexerting, and prevents you from having any extensive injuries when you're dressing. Sock aid, it's about the same thing. However, obviously it's for putting your socks on, but the purpose is pretty much the same. It limits you from overbending. And shower bench allows you to take a shower while seated. So which means the client can use less energy when showering, because, a lot of us wants to, when we hop on the shower, I don't know how many of you guys, you still turn on your music while you, showering. And obviously it's like warm water, right? And then you're doing a lot of movements, plus you're singing. So that takes up a lot of energy. With a shower bench, it allows you to, just take a rest while doing, while you're showering, right? So when you're like scrubbing your body, you can enjoy your singing. I guess one way you could say it. And the next one is a long-handled sponge or loofah. It allows the clients to prevent overreaching, especially on the posterior side of the body, right? So there are a lot of people that can't just use like a regular sponge or loofah when they're trying to scrub their backside. So they tend to overreach, right? Putting their their body into a difficult position. So we're going on to the next slide. So commode, I only suggest commode for toileting because it requires less bending of the knees, and it requires more leverage when performing a sit to stand from the toilet. I more recommend the commode for for the population, for this population that already have like they're starting to affect their other like other parts of their body. So when they're having like inflammation on their pancreas, which is one of the possibility, because it's starting to affect other body systems, right? So sitting on a commode will prevent that from putting pressure on your pancreas, and then also it gives you more leverage again from like sit to stand. And then use of electrical equipment is very important. When you're trying to clean, try to use your vacuums as opposed to sweeping. When you're cooking, you can use your mixers, grinders, choppers. Slap chop is one for when trying to chop your vegetables. Peelers and blenders. And last but not the least is the pill box. It comes with dividers to organize your medications. Moving on to the next. So environmental adaptations and modifications. I sort of put these two together because they sort of relate. So the purpose of environmental adaptation and modification is to ensure the safety and provide accessibility for the client. So an example for home modifications is to accessible storage of kitchen equipment and supplies. So instead of having them on the top shelf, try to put them on the lower shelf, right? So the if you use like kitchen equipment that you use the most, try to put them on the lower shelf because you tend to use them more frequently than others. So that would be helpful. Like I said, keep items on a designated spot for easy access so that we don't go around looking for them. Always have a closed chair nearby to take breaks when you're feeling overexerted. For showering, I suggest bath mats for more grip to prevent you from slipping, and ergonomic chairs and table for better posture, right? There's a typo there, so I'm sorry. It's ergonomic chairs and tables are and ergonomic tables are can be helpful, especially when you sit it upright and you have a good posture. It leads to better oxygenation when you're trying to breathe. So I guess for that part, you can also incorporate the breathing techniques that you guys discussed earlier. On to the next slide, please. And there's just also structural modifications, right? Stair lift, again, if your condition has gone severe to, I guess, to the point where you can't go up and down the stairs, a stair lift can be installed. Grab bars for support, and electric adjustable beds for easy transfers. So the picture I have here is the type of hospital beds where you could change it into different positions, because it allows you for more leverage when you're trying to transfer from lying to sitting and then sitting to standing. And then there's general adaptations and modifications you could do at your home. You know, simple thing as such adequate lighting, um, sanitary stations to prevent the spread of germs, because of cystic fibrosis. There's a lot of mucus trapped in your lungs, and then you tend to cough a lot. And then when you cough, you use your hands, and then with your hands you touch like different items in your house, or like you touch your bed, you touch the doorknobs, stuff like that. So it's good to have sanitary stations if possible to keep the spreading of the germs, especially now. We're living in a unprecedented time due to COVID, right? And declutter unnecessary items to prevent falls. On to the next one. So now I'm going to pass it on, my OT hat, to Jessica, who will be doing this component of this session.
Sorry, I'm gonna interrupt, but just back on your last topic of decluttering the home environment, that was a really good point. I find like in my home ever since I got diagnosed with like cystic fibrosis, I found myself tripping over things in my home, and I didn't know how important it was to have space. So thank you for bringing that up.
Thank you for sharing.
Okay, so hello everyone. My name is Jessica. I'm an occupational and physiotherapy assistant student at Humber College, and the OT sent me today to discuss some education topics with you and your caregivers. So if we just move on to the next slide. The first thing we're going to talk about is energy conservation. So this is really important for your population so that you can get better usage of your time and pace yourself out during your activities so that you don't fatigue so easily. So the first thing is pacing yourself. So this is giving yourself enough time to complete your task and eliminating rushing. So this will help you with fatigue. So if you're rushing, you're going to fatigue easily. Spread your activities out during the week. So maybe have more important ones at the beginning of the week, spread them out all throughout the week so that you're not all doing one task, all of these tasks in one day. And then don't over schedule your activities as well. So again, scheduling them without the week is very important. Planning ahead and organizing your activities as well is important. So one thing is gathering all of the items that you need for your activities. So for example, if you're cooking, maybe bring all of the activities you need to the table and sit and do that activity so that you're not constantly getting up during that activity. And then again, keeping your items at easy reach. So if, for example, in your kitchen, if you're using items on a regular basis, maybe having them at a lower cupboard. And if we move on to the next slide. Simplifying your task and setting realistic goals. So one thing that is hard for a lot of people, but is very important, is asking for help. So maybe asking your family and friends to help you out. Maybe you can give them tasks that you don't find so important to yourself. so that you can still continue to do tasks that you find important, but maybe your family members and friends can help you out with different tasks. Use adaptive and assistive devices. These will help drastically with fatigue. Adapt to a new way of doing things. This is another really hard thing, but your activity tolerance is going to be affected. So maybe doing things a different way will help you get through that activity completely. And then prioritize your activities. So again, maybe having people do things that aren't so important to you, and they can help you with those activities, and then you can still continue to do things that are meaningful to you. Okay, and then the next slide. Avoiding fatigues. This is really important so that you can continue to do the activities that are important to you. So one thing that a lot of OT suggests is keeping a diary to record when you feel most fatigued, and then you can schedule your activities outside of that. Plan to take rest breaks even before you are tired so that you don't fatigue so easily. Sit during activities where possible. Use breathing exercises, which we will also discuss about today. Rest after meals, because after meals we do fatigue more. Get enough sleep at night, so maybe implementing different things to get a better sleep. Limit the need to bend, reach, and twist. Use of assistive devices, again, is really important. Using good posture techniques, so maybe sitting up more straight and standing straight so that you're not putting more strain on your body, and that will cause fatigue. And then good body mechanics as well. So doing things like pushing and pulling rather than lifting. And if you do lift an object, maybe carrying it closer to your body to prevent strain. And when you are lifting, lift with your legs so that you don't hurt yourself. Okay, and then next, we have breathing techniques. So these are really helpful, especially for your population, because you do get short of breath quite easily. So these are helpful when performing different activities to help with that shortness of breath. It is also really good for anxiety. So all of these breathing exercises can be performed all throughout the day, during your exercise, before, after, whatever you see fit. So the first one is pursed lip breathing. So pursed lip breathing is you breathe in for 2 seconds as if you're smelling a flower, breathe out for 4 seconds as if you're blowing out a candle on a cake. It's really good for shortness of breath and when you're feeling anxious, and it can be paired with a lot of other different breathing exercises. So I thought we should do this exercise together if you guys are feeling up to it. So if we move on to the next slide, it's just kind of doing this activity together. So we're going to, again, breathe in for 2 seconds, breathe out for 4. Okay, so we'll start, breathe in, 1, 2, and breathe out, blow out the candles for 4. Okay, we'll do this 2 more times. Breathe in, out, in, and out. Okay, good. And if we move on to the next slide, it's just a different breathing exercise. So this one is diaphragmatic breathing. This helps you get a nice full breath. It helps with the quality of breathing, and this exercise can also be paired with pursed lip breathing. So for this one, you want to place your dominant hand over your ribs, and you want to push your stomach into your hand when you're breathing. So if we move on to the next slide, we can perform this exercise together. So I want everyone to place their hand under their ribs. And when you breathe, you want to push your stomach into your hand. And then you breathe out. Breathe in, stomach into your hand. And breathe out. So this exercise can again be performed during, before, after all of your activities. And it's a really good one for shortness of breath and anxiety. And then if we move on to the next slide, the last breathing exercise I want to talk to you about is progressive muscle relaxation. So this is a really good one for anxiety. So when we feel anxious, all of our muscles tense up. This teaches us to feel the tension in our muscles and then release that tension. So I do have a little activity for us to do this today. So if we just move on to the next slide, we can do this together. So you can do this activity in sitting, lying, whatever feels best for you. You want to do it in an environment that you feel comfortable. And you can open or close your eyes, whatever feels best to you. Okay, so for this activity, I'm just going to do a little relaxation. So you guys just relax. Okay, so take a slow breath in through your nose. Fill your lungs completely. Hold it for a moment and release the breath through your mouth. Empty your lungs completely. Take another deep breath and hold it for a moment. Then let it go. Feel that your body has already undergone a change. The tension in your body has begun to loosen and subside. Now let your breathing rhythm return to normal and relax. During this relaxation, I will ask you to tense various muscles throughout your body. Please do this without straining. You do need to exert yourself. Just contract each muscle firmly and gently as you breathe in. If you feel uncomfortable at any time, please relax and breathe normally. Bring awareness to your feet and toes. Breathe in deeply through your nose. As you do so, gradually curl your toes and tense the muscles in the soles of your feet. Hold your breath for a few seconds and release the muscles in your feet as you breathe out. Feel the tension in your feet wash away as you exhale. Notice how different your feet feel when they are tensed and then when they are relaxed. Take another deep breath. Again, tense the muscles in the soles of your feet. Hold this position for a few seconds. Now release. Feel yourself relaxing more and more deeply with each breath. Your whole body is becoming heavier, softer, and more relaxed with each moment that passes. Now bring awareness to your lower legs, your calf muscles, as you draw a nice deep breath. Point your toes up towards your knees, tighten these muscles. Hold this for a few seconds, and then let those muscles go limp as you exhale. Once again, draw a deep breath and tighten your calf muscles. Hold this for a few seconds and let it all go. Feel your muscles relax and feel the tension washing away with your out breath. In a moment, you will tense the muscles in the front of your thighs. If you're lying down, you can do this by trying to straighten your legs. You can feel the muscles pulling your kneecap upwards. If you're seated, you can tense the muscles by pushing your heels down to the floor. Take a deep breath in, tense the muscles in your thighs, and hold this for a few moments. Then release everything. As you do this, the blood flow in your muscles increases, and you may notice a warm tingling sensation. Enjoy this feeling of soothing relaxation in your thighs. Breathe deeply, tighten your thigh muscles, hold it for a moment, now release. Feel them relaxing completely. One more breath and deeply tighten the muscles in your buttocks. Hold it for a moment, now release them. And you're becoming more and more deeply relaxed. Now bring awareness to your stomach. Draw a nice deep breath and tighten these muscles. Imagine you're trying to touch your belly button to your spine. Now release the breath and let your muscles relax. Notice the sensation of relief that comes when you're letting go. Now bring attention to your shoulder muscles and muscles in your neck. As you slowly draw in a nice deep breath, pull your shoulders up to your ears and squeeze these muscles firmly. Now breathe out completely. Allow your contracted muscles to go loose and limp. You are calm, secure, and at peace. Now it's time to let go of all the tension in your arms, hands, shoulders, legs, and feet. And when you're ready, you can open your eyes and come back to the world. Okay, so this is just something that you can practice when you're feeling stressed. You can have someone read it to you. You can go on YouTube. There's lots of videos about it. And it's just good to do it in a place that you're comfortable in. And you can do it in sitting, lying, whatever feels best for you. Okay, and then the last thing that I wanted to talk about on the next slide is safe oxygen use. So this is really important for your population, as many of you will at one point may need oxygen. So the first thing that's really important is knowing that oxygen is a fire hazard. So be careful of small sparks and flames and handle the tank very carefully. And knowing that oxygen may seem ridiculous, but oxygen is medication. So you always have to do the prescribed dosage by the doctor, and it cannot be changed by anyone but the doctor. And actually receiving more or less of the required dosage can be harmful to you. So always stick to that prescription. And then if you go on to the next slides, we'll just go through the basics, do's and don'ts for oxygen use. So don't go near open flames. Stay away from cigarettes, candles, gas stoves, etc. Do not use any oil or petroleum-based products as they are flammable. And do keep your tanks in a secure place. It can be dangerous if they fall over or are near flame sources. Do place non-smoking signs in your home just to stay safe. Keep the service numbers of your oxygen providers close by. Ensure that all of your smoke detectors are up to date and working. And then when your oxygen tank is not in use, make sure that it's not near any heat sources. Okay, that's all I have for you guys today. So thank you for joining me, and I hope you guys learned something.
Thank you.
So
Thank
much.
you.
Just a quick thing, just because we started off the session and didn't get to really introduce ourselves. Why don't we kind of like introduce ourselves as patients and kind of say a fun fact about ourselves, like a hobby or something that we enjoyed doing. I can start. So I am Crystal Marty. I attended this session because I was diagnosed with cystic fibrosis, and a hobby that I like to do is I like to look into new beauty trends. So whether that's like false eyelashes or eyelash extensions, any sort of new makeup products that are coming out, I'm like a beauty guru. So I love that type of stuff.
Thanks for sharing, Crystal. My name is Jessica Font. I joined this session because I was diagnosed with cystic fibrosis. It was recommended by my occupational therapist. And something I like to do is spend time with my family and friends.
Thank you for sharing, Jessica.
Hi, I'm Emily. I joined because I was diagnosed with cystic fibrosis. I was recommended by my occupational therapist. Something that I love to do is I'm a huge foodie. I love like trying new foods and all that kind of fun stuff.
Oh, so do I. So do I. Thank you, Emily.
Amazing. My name is Chris Lee Angelo Comia. I joined this session because I was also diagnosed with cystic fibrosis, and I'm a sports guy. I love anything fitness related. I love basketball, but however, I haven't been keeping up with my my fitness by pretty much everything that I do. So
Thank you, Chrisley, for sharing. I'm just happy that I was able to attend the session where I have fellow friends just like me that are also diagnosed with cystic fibrosis. So it was very helpful, and I'm thankful to the OTs that took the time to explain the following topics during the session. Thanks, guys.
Thanks,
Thank you.
guys.
Thank you.